Okay, I think we should be live.
Yeah, it says streaming live on Facebook now for me.
Okay, cool. Okay, so we're going to obviously answer any questions that you've sent in. Hello, everybody. So we'll just dive straight in there. Question number 1. So I have been having Botox for years, but now my skin is starting to look dull. What can I do about this?
Okay, first, that's a really good question. And when I tell people if you continue doing Botox long term, that's what's going to happen. A lot of them don't believe me. But whoever sent this in doesn't need me to tell them because they're experiencing it already. So you have to understand why that's happening to start with. So we have certain cells in the skin, we have bounciness, elasticity, all that kind of stuff. We're born with it. So depending on what you do to the skin, that can increase or decrease over time. And what determines whether that increases or decreases is the nutrition, the trauma, all this kind of stuff. When you put Botox in, yes, it stops the muscle moving, and you may think, well, that's not going to do anything for the skin. Well, actually it does, because it's not just the nerve touching the muscle that stops the signal going through to stop the muscle moving. It also affects the nerves going to the oil glands. So when you put Botox in there, there's a diameter around the Botox where you inject, and in that diameter, in that circle, so if I inject it right in the middle there, everything around there, all the oil production just stops completely. And we know this, the scientific studies that have proven it. So that completely stops. Everything around that circle, just around it, like a ribbon around that area, the oil production in that area goes into overdrive to make up for its partner that's not working anymore. When your oil production is going up and down like this constantly, it's not just the moisture of the skin, it's the ability to trap moisture that's already there, that's lost. It's the ability to produce new cells, because cells are made of oil, they're made of lipids and fats. You can't do that. So you can't make fibroblasts, which are the cells that make collagen. That means you can't add hydration because the same cell makes hyaluronic acid. All these things are affected, and the skin becomes weaker because you need lipids and oils in between cells to glue them together and form a strong, rigid barrier, which is what gives the skin the barrier function. So without any of these things, of course, your skin is going to get worse over time. Botox worsens skin quality. It's a myth that it's preventive. If anything, it's an accelerant for skin quality loss. So that's the reason why when people come to me for Botox, I always advise them of that first, because in my honest opinion, if you don't tell them the long-term consequences, and the consent that I get from that person isn't valid because they're not been given all the correct information. So instead of using Botox to get rid of wrinkles that are there, I prefer to stop wrinkles from coming in the first place. So instead of using a treatment that reduces skin quality, we just do things that increase skin quality, increase the hydration, increase the elasticity, increase the collagen, the hyaluronic acid, all this kind of stuff over time, so that the wrinkles, all these problems never appear in the first place. And then something different happens. Patients don't come in asking for Botox. They just don't come in full stop. They don't ask for anything. Maybe once a year, once every 2 years, they might come in, add some skin boosters to add hydration, because hyaluronic acid is best injected than any kind of cream or serum, but that's it. And not only do they not ask for anything, they're saving a lot of money. In the long term, they're barely spending a fraction of what they would have spent if they just carry on having Botox every 3 months. Now, you can do this in a number of ways. The best way, really, in my opinion, is microneedling. And that's something that we do professionally in one way, and something that you should do at home in a completely different way. And the variables of microneedling are very, very fine. You do it slightly too frequently or slightly too infrequently, you're going to trigger the wrong cells. You do it slightly too long in the needle size, slightly too short, you're either going to get too much inflammation and fibrosis and scar tissue, as opposed to nice bouncy trampoline-like collagen. So it's that itself is probably a day's course that I could teach, but I'll keep it short for today. But that's the best thing, being in this industry, I can pretty much get whatever treatment I want, either at cost price or free most of the time. Mm-hmm. I've never had Botox. I've never had filler. I've never had lasers. I've never had radio frequency. I've never had facials, none of this stuff. The one thing that I do is microneedling at home with good skincare.
Cool. So what exactly is microneedling? And don't be too scientific about it. Okay. Just if you were talking to a normal person,
Okay.
how would you explain microneedling?
Microneedling. So I'll put it to you this way. When a child cuts themselves playing, you see the cut, and then maybe a day later it's completely disappeared, like as if there was nothing there in the first place. That's because of wound healing. So wound healing can generate collagen if it's done in a very, very precise way, because wound healing can also create scar tissue. People say the more inflammation, the better. Actually, it's not the case. If you're in a car crash and you get a burn, the amount of inflammation you have is going to cause scar tissue all over your face. So you don't want too much at all. But essentially, it's a way of wound healing to generate collagen using tiny, tiny needles that prick the skin, go in and out very, very quickly. There are different methods. I won't get into all that. But the physiology, the concept is wounding the skin to generate release of chemicals within the skin. And those chemicals trigger cells to make things like hyaluronic acid, collagen, get rid of wrinkles, brighten things up, get firm skin, bouncy skin, etc., etc. The best way, and I really do need to say this, is combining professional needling with home needling. They're completely different, but you definitely want to combine them together for the best result. When you do that home needling and you see how good it is, those are the people that carry on for the rest of their life, and they rarely come in afterwards to spend any more money on any more treatment.
Yeah, but even if you were to, like, let's say, start home needling, you still want to see a professional first, so
100%.
they can obviously explain what to do,
Yeah.
how to do it, so you're not causing more damage, essentially.
Absolutely, because home needling, even if you're 0.1 millimeters wrong in your choice of needle length, that makes the difference between getting great skin and getting lots of hyperpigmentation, looking like you're a trauma victim.
Yeah.
Now, you may think I'm exaggerating, but I'm not, because the cells, the layers of cells, are even less than 0.1 mil. So if your needle length is 0.1 mil off, then you're going into a completely different layer, which causes a completely different change in the skin, completely different type of trauma. So it's very, very finely controlled. And you have to do it the right way. This might be controversial, but I would say most people that carry out microneedling are doing it wrong. There's one person that has more needling experience in the world than anyone else, and his name's Des Fernandez, the guy that invented it. I was chatting with Des not that long ago, specifically about needling, and we both agreed most people do it completely wrong. When you come to me and we do needling, I don't just bring you in and then put some needles in your face and send you home.
Yeah.
I change your diet. I give you a list of supplements to take and not to take. We give you a specific roller to use at home, specific products to put on top at home, and then we come in. And then I'll do it particularly in my own way. I won't use a machine. I do every single thing by hand manually, so I can control everything. And then part of that treatment is that I'll use LED therapy for faster healing to control your immune system for you, so you don't inflame too much and produce a scar instead of nice skin. And then you come back, and then I put hyaluronic acid on, but not just any hyaluronic acid. I specifically choose the weight. I want a weight that's around 3,000 kilodaltons. Now, you may think, what does that mean? But if you have a low weight of hyaluronic acid, this is controversial, but it's proven. It can cause increased spread of cancer. It can cause increased risk of scar tissue, increased risk of fibrosis, really, really bad changes that you don't want. So the choice of hyaluronic acid is very, very important, and not a lot of people know that. So I'll put a very specific type on for you, and then you'll carry on at home doing certain things. And then, because I'm medically qualified, I can write prescriptions for certain things. I can write prescriptions for certain antihistamines, certain non-steroidal anti-inflammatories, things like that. And you'll take those immediately after the needling. And the good thing about coming to VL and having it with us is, because I'm not a beautician or a hairdresser or whatever, I'm able to do those things. I'm able to write those medical prescriptions and do medical things which other people just can't, unfortunately.
Yeah.
And as I said, of all the things I have access to in this entire industry, I choose to say no to nearly all of them, apart from microneedling.
Okay, cool. So mesotherapy, what exactly is mesotherapy? It kind of brings us on to that question, which I've just made that up myself, actually. Nobody asked me.
So mesotherapy.
What is mesotherapy?
Meso it comes from the Greek, and it basically just refers to size. Specifically in this case, talking about small things. So small therapies is kind of what it means. So all you're doing, it was invented in the 1950s by a man called Dr. Michael Pistol. And he basically realized that patients need certain, shall we say, active ingredients in certain areas for things to happen. Up until that point, people just put oral supplements in. very difficult if you've got a problem on your elbow to take something, go through the entire digestive system into the bloodstream and then all the way to the elbow to cause change. So he thought, well, what if I take those ingredients and put it directly where it's needed? And that's how mesotherapy is invented. It's just a concept of getting the ingredients that you want that are chosen specifically for that person into the area for that person. As an example, some people may be lacking a lot of hydration. So I might take certain types of hyaluronic acid and specifically place it in strategic points around the face. That's a form of mesotherapy. I'm injecting the hyaluronic acid in tiny, tiny little dots all over. Fat dissolving is another form of mesotherapy. So I'm going to take my dissolving agent, inject it specifically just to where the fat is, and that's going to do the thing that I want it to do. If someone wants to get their hair back, I might put certain peptides and multivitamins and things like that specifically in the scalp and combine it with the treatments to get the scalp to grow more hair. So mesotherapy is just a way of getting specific ingredients to specific areas.
Yeah, and you always tailor make that, so you don't really like to use pre-mixed things, because there's a lot of pre-mixed brands available which are quite well known, and people do come in and ask specifically for them. What's the main difference then, kind of between what you can customize and what's kind of pre-mixed?
So the reason they're pre-mixed, it's a good question. The reason they're pre-mixed is because most people that do this sort of thing don't have full medical degrees, dental degrees, pharmacological degrees, etc. So they don't know what's actually in there, and they can't talk about the biochemistry. They can't improvise and say, if you give them a random ingredient here and a random ingredient there, they can't tell you whether you can mix them or not because they're not in the same product. Whereas if you do have this kind of qualifications, you can just pick individual ingredients. And I can just know, okay, so if I've got this form of vitamin C, I can't have this form of this particular peptide, because the vitamin C in the form of ascorbic acid is going to hydrolyze the peptide and it's going to be useless and it's going to form bad products, blah, blah, blah. So because I have that knowledge, I don't need a pre-mixed thing that they sell to most people. I can just look at the skin. I know what's causing that appearance on a cellular level. So if it's pigmentation, I know that melanocytes are clearly involved, keratinocytes are clearly involved because they pick each other. I know my mesotherapy has a particular depth because I know how deep they are in the skin. I know what ingredients they need to communicate better to each other, and then I'll make it specifically for that person. Even fat dissolving, you'll hear a lot of names like Aqualix, Kybella, etc. I don't even use a pre-mixed fat dissolver. I'll take raw ingredients and make it for that person. So generally I might use things like phosphatidylcholine, acetyl-L-carnitine, taurine, caffeine, etc. All these things. And depending on the person, if their skin needs tightening at the same time, I might even add in things like organic silica, DMAE, polyvitamins, things like that as well. So it's always custom made to each individual person. And when you're seeing someone that can do that, by definition, you're seeing someone that knows more about what they're doing because they're able to improvise and do whatever they need to that individual, as opposed to treating everyone the same. My advice would be to always go to that kind of person.
Yeah, definitely, because it's much more bespoke, therefore going to get you the results that you want. Okay, so moving on to the next question.
Yeah.
You hear me okay?
Yeah. You broke up for a second, but you're okay now.
Okay, cool. Okay, so a bit of a controversial question. When should I start doing Botox?
Yeah, this is going to be controversial. So as the owner of the clinic, Vanessa's not going to like this answer, but I'm always honest and I don't lie.
Exactly.
The best time to do Botox is never. All Botox ever does is worsen your skin quality slowly and slowly. There may be a short-term cosmetic result, such as a loss of a line, but what medical result is that giving? It's giving a completely worsened skin barrier function. It's giving completely compromised oil production in the sebaceous glands. It's giving completely compromised thickness of skin that will reduce over time. So, for example, if you go to a sunbed, you may get a short-term cosmetic result in the color. Long-term medical result is skin cancer. And you have to realize that that short-term medical result is a sign of that short-term cosmetic result. A tan is a sign of a long-term medical result, skin cancer. Botox in the short term may give a short-term cosmetic result, but the long-term medical result is worse skin quality. So there's never any good time to do it. The best thing to do if you want prevention is to just look after yourself. Have a good diet, make sure you get enough sun, use sun cream, and then make sure your skin is fed good nutrients, microneedle at home if you want to. And then your skin will just increase in quality as you age again and again and again. those lines will rarely even come. And at that point, you won't even want Botox, even if it does help.
And a decent skincare routine is obviously really
100%.
important.
You've got to combine that with the microneedling, yeah.
Yeah. Okay. What, in your opinion, are the best treatments for the eye area?
Good question. A lot of people are concerned about the eyes because they look tired. They don't want this tired look. But you have to break it down into what constitutes that look, because there are different factors that contribute to that look, and each factor being different requires a different method to treat it. For example, you know, a combination of factors might be it's dark, the skin. The skin is non-elastic. If I grab it, my skin snaps back because of elasticity. If it's not elastic, I'll grab it and pinch it like this, and it will just stay raised. So there's a lack of elasticity. There may also be a lack of volume in the area as well. There are three different things: color, elasticity, volume. One thing is you're going to treat everything. Filler can replace volume because filler is a volumizer. That's the whole point of it. You're putting things in there, it's going to get bigger. But filler isn't going to change the color. Now, there are fillers that have things in there which can brighten skin, but there's a big difference between using filler that volumizes and something designed to just brighten skin.
Yeah.
And then filler isn't going to make the skin elastic. It's not going to give it bounciness back, because when you have a balloon that you inflate and it becomes really stretched, it's nice and smooth. But if you keep doing this, inflating and deflating again and again, the balloon becomes weak. What do you think happens to your skin if you keep doing that, especially if the skin is thin? So you've got to look at skin quality as well. So there's many different things you can do, depending on what the individual factors are that has led to your individual complaint.
Yeah, absolutely. And again, it's individual basis as well.
Has to be.
Okay, so this is a good question. I don't want to get injectables. What can I do to remain youthful? Quite a lot, actually.
Very, very good question. I think that's a lot of people relate to that. So there's a lot of things you can do, and there's a lot of things you should avoid if possible as well. It's a combination of both. You can do a lot of good skincare, a lot of good microneedling. They're great, and I would recommend those to pretty much anyone. But if at the same time you smoke a lot, you never wear sun cream when you go outside, and use a physical exfoliant like a pumice stone 5 times a day, it doesn't matter what good skincare or needling you do, your skin's just going to get worse anyway. So it's not just about what you do, it's about what you don't do. Things that will degrade your quality of DNA, like smoking, really, really avoid those. Sensitization to the sun, you want to wear sun cream whenever you can. You want to make sure your diet isn't full of rubbish. You want good omega-3, omega-6, micronutrients and minerals, lots of vitamins as well. All these things are required for the skin to be healthy. And certainly when I do microneedling for people, this is what I control. I give them a home care plan specific to them. Had a lady in today that she told me her current skincare routine, her current supplements and everything. I said, okay, well, I need to change it specifically for you and change it to something completely different. Yeah. So it's about all those things that you should and shouldn't do. And then also in terms of the actual interventions that you carry out, as long as you start early, microneedling is brilliant. More collagen and good skin growth, as long as it's done right, which we can help you with if you'd like to. Now, I know they said they don't want injectables, and microneedling isn't an injectable. And when you see the home roller, prickles on a prickly bush are bigger than the needles on a home derma roller, and you'll barely feel them, and that's all you need. That's a really good, very, very cheap, very easy thing to do. A home derma roller might be £7 or £8 on Amazon, something like that. So it's very cheap. As long as you use good skincare, you're not really going to be asking for many injectables.
Yeah. Okay, good stuff. Okay, we've kind of covered this, but we can go through it again. People, this is another question. So people always say that I look tired. What can I do about this?
Sure. So tiredness, you have to elicit what that particular person has that makes them individually look tired. A lot of the time it's to do with eyes, which we've covered, but there are other factors as well. So for instance, when people's foreheads are aligned well, that can make people look stressed, which in turn implies tiredness as well. So it might be that they have lines in their forehead. It might be that they have general lines everywhere. Maybe their mouths are downturned, which can not just look tired, but also sad as well. So it may be that it's not just the eyes, but gravity has taken its toll on their soft tissues and started to pull things down. Because there are so many different variables that can lead to that kind of look. And the word tired means different things to different people as well. Yeah. It's really a case of figuring out what that person has in terms of a diagnosis, and then figuring out to implant individually for them. The eyes are a main one, and skin quality definitely as well.
Yeah. Okay, what else have we got here? Can you do anything to treat hair loss?
It depends on what the cause of the hair loss is. As an example, it's an athlete or some kind of serious bodybuilder, they're taking steroids, then that can trigger the loss of hair as well, regardless of what clinical treatment I do or anyone else does. As long as that cause is still present, you're never really going to get any result. So there are things you can do, but it depends on the cause. For some women, actually, they get it around the menopause age, and so it's a hormonal thing as well. There's only a certain amount you can control someone's hormones without doing something really drastic. So you can do certain things like PRP, platelet-rich plasma, also known as vampire facial, and combine that with minoxidil, which is, I think it's the brand name is Regain, which a lot of people have, 5% for men, 2% for women, concentrations. Combine that with copper peptides as well, topically. And then we can combine that with mesotherapy, where you inject into the area, not just with PRP, but also things like vitamin B7, biotin, certain peptides that trigger the growth and things like that as well. But again, it's only going to work if you figure out what's causing the hair loss in the first place and then go from there. It's an area of cosmetic medicine which is always evolving because we're always learning new things. For example, PRP, people thought that was incredible ever since Kim Kardashian said she got vampire facials, but the truth is there's very little it actually does. And personally, I would only really consider using it for hair because it has VEGF, vascular endothelial growth factor, which causes angiogenesis, blood vessel generation. And if you're going to put new hair strands and bulbs, they need oxygen to grow. So you need new blood vessels. So that's one of the few applications for PRP. You can combine that with needling to stimulate blood flow. You can combine that with mesotherapy, a few things on the basis of getting the cause of why the hair is lost in the first place.
Okay, perfect. Okay, what is the, hang on. Your Wi-Fi, I think, keeps breaking up, Abs.
Is it?
Yeah, I just want to sort this first. I don't know. Can you connect to can you personal hotspot or anything?
Let me try that.
And then we can continue. I don't know why it's doing this. Try that first.
Yeah.
And then we'll go on. I think we need to start paying the Wi-Fi bill. Is that any good?
Can you hear me now?
Yeah.
Yeah. How's that?
Okay. Right. We'll crop this down anyway, so it's okay.
Yeah.
Okay, perfect. So this is quite a common question, as in like me and you think it's quite common and people know it. But what is the difference between Botox and fillers?
Okay. Go back to basics.
Yes.
So I think, for us in the industry, we take that for granted because we don't even bother asking it because it's for us, it's what we do.
Yeah.
But for those that really don't know, think of it this way. One is just volumizer. It makes things bigger. And the other just stops the connection between nerves and muscles. So the muscle can't be activated.
Yeah.
And that's really all it is. So for example, in the lips, a lot of people want filler to make them bigger. In where they have lines and wrinkles, part of the reason lines and wrinkles arise is because the muscle is constantly going back and forth. Over decades, doing that to the skin is going to leave a crease, just like you're folding a piece of paper or leave a crease in. So you stop the nerve from activating the muscle and the skin stops doing this and it just stays still. So it can give you a short-term cosmetic benefit. So one is to make things bigger, one is to relax the connection between nerves and muscles.
Can you use, I know we've spoke a lot about Botox for like lines and wrinkles. Yeah. Can you use it anywhere else in the face? Let's say maybe to correct things on the face or anything like that?
Absolutely. So you can use them together. You can use them individually. So if you take Botox, for instance, the main three areas are the frown area, about there, the forehead, and then around the eyes. Okay, I think most people will know that, especially if they get Botox regularly. But you can also use Botox. I can use it on the nose. You can use it around the nose to stop the mouth coming up as much if they've got a gummy smile. I can use it in the clenching muscle here, either to slim the face or for dental reasons. I can use it in the clenching muscle in the head, like this. I can use it all around the head and neck to reduce migraines. I can use it here, just below the corners of the mouth, because if those muscles are overactive, it pulls things down and they look sad. When you relax it, it can make them look happy and go up. I can do it to the muscle, bringing the nose tip down. I can do it here to stop a cobblestone appearance on the chin. Most muscles in the face, you can use Botox in some way or other. Filler, again, as long as you're outside of a blood vessel, technically you can place filler there. I can do it in the forehead, in the temples, in the eyebrows, nose, under the eye, cheeks, outside cheek, inside cheek, lips, jaw line, jaw angle, chin, back of the jaw here. I've done filler in earlobes, in nipples, in all sorts of places. You can even use filler to relieve scars, because some scars are tethered to the skin underneath. You break that tether and then you inflate some filler underneath to lift that skin back up and it looks smooth again. There's a lot of things you can do.
Yeah. And I mean, I know you're not the biggest fan of Botox, but there are a lot of benefits where you can use it.
Absolutely, even for medical reasons. So for instance, if I wanted to make the jaw a bit slimmer because they're grinding their teeth and they're going to have no teeth left, I'll use Botox to relax that muscle. And over time, the muscle will just get smaller and it won't be able to generate as much force. Sometimes they've got a spasm of the eyelid, what we call a blepharospasm. That was actually the reason Botox was commercialized. It was to treat blepharospasm. So you can put it in there and it will just stop the eye twitching constantly, which is obviously an annoyance and an inconvenience for people in their day-to-day life.
Okay, that's good to know. Okay, what can be done to firm up sagging skin following weight loss around the cheeks? This is a really good question.
Sagging skin after weight loss in the cheek. There are non-surgical things you can do and there are surgical things you can do. So it depends. Is it the skin that's sagging, or is it as a result of aging, things underneath the skin that are sagging as well? Generally, when you lose body fat, you get more definition because there's less between the bone and the skin. So when the skin wraps around the bone, you see the angles a lot better. That's why actors that put on weight or lose weight for a role, they look completely different. And they got so much more different definition in their face. Look at Christian Bale in Batman versus when he did that film about Wall Street or whatever. You can barely see his cheekbones in one and it's very defined in the other. So sagging skin, there's a lot of things you can do. You can actually physically reposition the skin with something like a thread lift. But the problem with the thread lift is it doesn't change the quality of the skin as much as other treatments. So you can reposition everything higher up, but the skin still looks a little bit sun damaged, a little bit wrinkly, a few lines here and there. Then you're going to need to address that in other ways. Again, microneedling is a fantastic way. I would always do that. Alternatives, if someone didn't want that and they wanted something really heavy and invasive, they can look at something like lasers to increase skin laxity. They can look at radio frequency. They can fractional RF microneedling, fractional lasers, all sorts of things. If you wanted to go all the way, you could even look at something called a type of facelift where you reposition the tissues, and also you take skin out to just sort of stretch everything back. That's another option. So depending on your budget, your time constraint, how much of a result you're after, there are lots of different options available. And
again, it's down to an individual basis. So the best thing about something like that is to just come in and see, because I mean, it literally is individual. Everything that we do is just so bespoke.
Yeah, absolutely.
Okay. What do you suggest for puffy eyes and kind of hooded eyelids? Invasive, non-invasive.
Okay, so let's separate those two. If we look at puffy eyes, generally the puffiness is because of the eye bag underneath. Okay, a true eye bag is a fat pad that's slipped forward. As we call it pseudotosis or pseudoherniation. So to treat a true eye bag, you need a true eye bag treatment, which is blepharoplasty, which is a surgical removal of that. You can try and do some things non-surgically, but they're not going to be anywhere near what a plastic surgeon can do with a blepharoplasty. You can try and put filler around that area, around that mound, to try and blend it into the other area, but it's never going to be perfect, and you're still going to see something come through, quite frankly. So there's a few different things you can do. For something that's a true eye bag, I think seeing a plastic surgeon is your best bet. That's going to give you the best result for sure.
Yeah.
What was the other one? Hooded eyes, you said?
Hooded eyes, yeah. You know,
Hooded eyes, it could be a couple of things. It could be that the skin itself is lax, in which case you can do some kind of skin tightening treatment, or there's too much skin. They're two completely different things. Sometimes you get a combination. Probably in most cases, there's some element of both. If there's too much skin, you know, common sense would say there's too much, to take some out. If there's too much of one color when you're mixing paint, you take some of that out, whatever. And so in this case, that results to a surgical blepharoplasty, upper blepharoplasty. You remove some of the skin. Certainly in the Far East, double eyelid surgery is quite common, from what I hear anyway. Alternatively, to tighten the skin, you can look at something along the lines of plasma pen. So I'm going to go back to microneedling for a second, and you'll see why. Microneedling is just wound healing. It's the wound healing cascade. You wound the skin. You're using very, very small needles to do that. But you can't use that on the eyelid, because if the needle goes through the skin, you're literally going to hit the eyeball. So in cases like that, you may want to use something that doesn't go through the skin, something that causes a wound, but not by physical penetration. Plasma pen, things like that, they use heat essentially from plasma, and that heat damages the skin instead, and that triggers a wound healing cascade. But to get the best result, ideally, you need good skincare before you even start. If you knock down a wall and you don't give the builders bricks to build a new one with, what they're going to do? So you've got to give the bricks to the builders first, then show them what they're building. You've got to give the skin the right nutrients first, then cause the wound, so it's got everything it needs to rebuild better than it had before. Yeah.
What about would you do a mini thread lift for the eye area? Would that
you can
work?
do, yeah, but when you're lifting the eye area, you're generally lifting the eyebrow or outside here, or the corner of the eye for a fox eye look.
Yeah.
You're not generally lifting the actual hood area here, the actual upper eyelid, because that's contained between the eye, the opening between the eyelids and the eyebrow.
Yeah.
So you're not really going to lift the actual eyelid too much with something like threads. They can help to some extent, you know, tighten up the area around using rejuvenation threads, but there's only so much that can do.
Yeah, and again, it's kind of managing expectations as well, which is a big part of it. Okay, so let's do two last questions. Okay, so what would you propose for low set brows? I tried Botox, but it didn't lift. I'm 34.
Okay, so I wouldn't generally use Botox for a low brow, because if you continue using Botox and the skin quality decreases, the skin laxity increases. So after a while, you might get a short-term cosmetic benefit, but the long-term medical risk is that the skin is so lax, even if you put Botox in, there's so much, it's just going to droop anyway, and it's going to be even worse than when you started.
Yeah.
So again, there's invasive options and non-invasive. An invasive option might be some kind of surgical, seeing a plastic surgeon for some kind of surgery to take out a bit of skin and lift everything up. That's one. It's very expensive, but it's also going to get you the most dramatic result. Something less than that would be a non-surgical intervention like thread lifting. You can take threads to different points of the eyebrow and really suspend them higher up, so it pulls everything up. At the same time as that procedure, generally it's best to combine the lifting thread with a skin thread or a rejuvenation thread, which doesn't lift anything deep like the lifting thread. It sits within the top layer of the skin to just generate a load of collagen, and that tightness, that new elasticity also will give a slow lift in the long term as well, and they'll work together for the best result. Another option would be microneedling to generate more collagen in that entire area, and that will tighten things up as well over time.
Okay, so again, combination treatments as well is possible.
Yeah.
Okay. Another question: can you do anything to treat chickenpox scars?
Absolutely, yeah. I mean, you can do a lot of things to treat most types of scars. If the scar, you have to work out what your diagnosis of that scar is. That's really important, because that determines your treatment plan. If you get the wrong diagnosis, you get the wrong treatment plan. And the wrong treatment plan for a scar tissue may make the scar actually worse than it was when they started. And you're going to get a lot of problems, not just as a clinician, but as a patient as well. You can be very frustrated. You have to ask yourself, if the skin is at this level, is the scar depressed, i.e. at a lower level, I guess taking a step down, or is it above? So is it atrophic or hypertrophic? Once you decide which one of those two it is, then you know what you can do. If it's atrophic, if it's lower, You can, if it's tethered to the structures underneath, you can break those tethers and then release the skin. So it comes back up, and then put some filler underneath to inflate it up. If it's too high up, if it's hypertrophic, you can remodel the skin. So you take away current tissue, connective tissue, and then put new connective tissue in. Part of the reason scars form is connective tissue, collagen. If there's scar tissue, it's either too much or too little collagen, and it's also been placed in the wrong orientation. Healthy skin versus scarred skin, in terms of what they're made of, are identical for the purposes of this conversation without getting too deep. The difference is, in scar tissue, collagen might be lined up on top of each other like that, okay, to protect itself like a shield. Whereas in healthy skin, it's like a lattice, like this, like a basket, like a trampoline, so that when you bounce in the middle, like a trampoline, it goes back and forth. Whereas when it's like this, there's no give, it's rock solid. That's why scar tissue has the properties that it has. It's all about diagnosing that person. And when I see them in person, I'll physically touch the scar, I'll try and move it, I'll figure out what it's doing, what it's not doing. Then that'll help the diagnosis. And then we can go from a treatment plan from there.
Okay, perfect. I think that's all we've probably got time for today.
Yeah, I've got a patient soon, actually.
So yeah, thank you for your time, and
No
thank you
problem.
obviously everybody for your questions. We'll do another one. We'll try and do one of these a month.
Yeah.
You know, just to stay in touch with everybody, and obviously
If
just
there's
to
any that we didn't answer, we'll try and get to them next time as well.
exactly. But yeah, thanks everybody. Bye.
Take care.
Bye.